I was looking at the hospital expenditures in the relation to the varying types of hospital visits in the United States. As we know, we spend more on healthcare per capita than any other members of the OECD, which is a group of, I guess, member nations of similar levels of economic development. And even with that, we actually fail on the various healthcare metrics. We spend about 17% of our GDP on healthcare, but at the same token, we have a lower level of lifespans. We have higher rates of mortality and infant mortality, and even when we adjust for purchasing power parity. So what I wanted to look at was how much of this expenditure was related to different types of visits in the hospital. So you would have your emergency room visits, you would have your hospital admissions where you actually stay at the hospital, and you have your outpatient visits, which is more of a preventative care situation. And so what I ended up finding was that while the data for the entire United States would be inconclusive, there are certain pockets of data which we can look at where there are certain relations. For example, we have certain states which have a low number of emergency room visits, but a high number of hospital admissions, which implies that when they are going to the doctors, and which is an emergency room, they are staying.
Okay. So only if they go for an emergency room and then they stay, they're technically in
they're in a more severe state of health crisis.
Yes.
So they're not getting the preventative care they need because they're getting treated at a later stage.
Okay.
And we also have situations here where we look at the per capita spending, which is how much we're spending per person, as well as their outpatient visits, which generally is a more preventative care approach, like your annual visits and so on. And we found that in certain states, it does matter. For example, there's a huge, New England, we have a huge amount of outpatient visits, and compared to many of the rest of the states, we have a lower amount of actual hospital admissions. So we're going for our checkups, so we don't have to actually go to be admitted for a long period of time later. And ultimately, we found that.
So why would it be?
Why do we spend more?
Yeah, in New England for this.
It is because of the way we have set up our healthcare in these states versus in other states. There's a higher emphasis on preventative care in many of the New England states, and certain view outlooks on healthcare is more progressive here than in other parts of the country. So while we have this more of a forward-thinking concept, it has, in some states, it's shown to be effective, and others not quite so much just yet. But there are other states here which, for example, if you look at the red states here, there are more than 500 emergency room visits per year per 1,000 people.
Okay.
So in those states, they are going there, and not only that, but specific in these, they are staying there when they do get admitted. Yeah. But ultimately, because of the fact that it's so varied and there are clusters of data, information all over the place, it's impossible to say, we can't say it for the entire United States, but we found that generally the overall cost of healthcare expenditure in the United States is not hugely determined by the actual cost of direct patient contact, of direct patient care. Yeah.
So is it basically, you can't find a correlation between why we're spending so much?
It's a very weak correlation
Okay.
for patient care. The current belief system is that there are 5 main factors that increase our hospital expenditures in waste and inefficiency, and those would be the use of overtreatment, because we follow a pay-per-service structure in the United States, so they get paid for everything, individual thing they do, versus paying them for the actual health of the overall population. There's also going to be a certain amount of cost loss to the administrative factors, and the failure to coordinate care. Because a lot of our hospitals have been switching to an electronic health record that does translate to other, but some of them still don't. Some of them still follow paper records, and if you go to the ER, they don't have access to your old records. There's also going to be a certain amount lost to bureaucratic, legalities, and a certain amount lost to fraud. But overall, it appears that, at least according to this, that it's not hugely affected by what kind of visits you're taking to the hospital.